Every 40 seconds, someone in the United States has a heart attack.
Chest pain is very common. It accounts for about 5% of ER presentations in the US.
Emotional stress or anxiety can trigger chest pain as well.
You have chest pain, particularly if it's new, severe, or associated with other symptoms, like, again, that shortness of breath or nausea. Those are reasons that you want to go into the emergency room.
Do you know that every day more than 100 people around the world die from a heart attack? These staggering statistics show how common heart attacks are globally. Let's look at warning signs to look out for up to a month before this unfortunate incident. Learn these warning signs and you might just save a life. One of the most apparent signs of an impending heart attack is chest discomfort. This problem can manifest as a feeling of pressure, squeezing, fullness, or pain in the center of the chest. It may last for a few minutes or come and go intermittently. If you experience such discomfort, especially if other symptoms accompany it, seek medical attention immediately. Also, you can experience a burning sensation or mild discomfort in the chest that can be easily mistaken for heartburn or indigestion. Nonetheless, it's essential to remember that these chest discomfort symptoms can be experienced differently depending on the individual. Some may experience only one symptom, while others might experience a combination. Shortness of breath is another significant sign to look out for. Now, I'm not talking about shortness of breath after a workout or a jog, but the one that happens after sitting in an office all day or waking up in the morning. So if you find yourself struggling to catch your breath even during light activities or at rest, it could be an indication of an impending heart attack. This problem happens because the heart is not pumping efficiently, reducing oxygen supply to the body. Don't ignore this symptom. Seek medical help promptly. Feeling fatigued even after enough rest can be a warning sign, especially in women. When the heart's blood supply is compromised, the body doesn't receive sufficient oxygen and nutrients, damaging that part of the heart. Typically, the heart tries to compensate by working harder to pump blood. This extra workload leads to fatigue. Initially, it will last a short while and happens rarely, but it will become more regular and last longer over time. So if you notice persistent and unexplained fatigue, it's crucial to get it checked by a healthcare professional. However, fatigue can be a sign of other health complications. Therefore, you shouldn't conclude that fatigue alone will trigger a heart attack. Experiencing dizziness or lightheadedness can be alarming, mainly if it occurs suddenly. It happens because of two reasons. First, it happens due to decreased blood flow to the brain. During a heart attack, the blood flow to the heart muscle can be significantly reduced or completely blocked. This can decrease blood flow to other body parts, including the brain. When the brain doesn't receive an adequate supply of oxygen and nutrients, it can result in dizziness and lightheadedness. Second, it occurs because of a drop in blood pressure. A heart attack can cause a sudden drop in blood pressure. Low blood pressure, or hypotension, can reduce blood flow to the brain, leading to dizziness and lightheadedness. The drop in blood pressure may occur due to the heart's inability to pump effectively or the release of certain chemicals that affect blood vessels. If you feel dizzy or lightheaded along with other symptoms, seeking medical attention is essential. Taking preventative measures after noticing this sign may be the difference between life and death. While chest discomfort is a classic sign, it's important to note that pain or discomfort can also radiate to other areas of the body and can sometimes be associated with an impending heart attack. However, it's important to note that symptoms can vary from person to person. The most well-known symptom of a heart attack is chest pain or discomfort, often described as a squeezing or pressure-like sensation. However, some people, particularly women, may experience atypical or silent symptoms that are not localized to the chest. Some of them include pain or discomfort in the left arm, mainly radiating down from the shoulder to the hand, which is a classic symptom that can suggest a heart problem. In addition, pain or discomfort in the jaw or neck, especially on the left side, can sometimes be a sign of an impending heart attack. This type of pain may occur with or without chest pain and is more common in women. Also, some people may experience back pain during a heart attack. This pain may be felt between the shoulder blades or lower in the back. It can be persistent or intermittent and may come and go. If you or someone you know experiences any of these symptoms, especially if they are severe, prolonged, or worsen over time, it's crucial to seek immediate medical attention. Calling emergency services or going to the nearest emergency room is the best course of action in a suspected heart attack situation. Nausea and indigestion can be symptoms that occur during a heart attack. While not everyone experiences these symptoms, they can sometimes indicate an impending heart attack or be associated with other cardiac conditions. It's important to note that these symptoms can have various causes, and experiencing nausea and indigestion alone does not necessarily mean a heart attack is imminent. During a heart attack, the blood flow to the heart muscle is restricted, usually due to a blockage in one or more coronary arteries. This blockage leads to a lack of oxygen and nutrients reaching the heart muscle, which can cause chest pain or discomfort, known as angina. In some cases, the nerve pathways that transmit pain signals from the heart can communicate with the nerves that supply the stomach and digestive system. This situation can lead to symptoms such as nausea, indigestion, heartburn, or even vomiting during a heart attack. These symptoms may be more common in women, older adults, and individuals with diabetes. Profuse sweating can be one of the symptoms that some individuals experience before or during a heart attack. A heart attack typically occurs due to a blockage in one or more of the coronary arteries that supply blood to the heart muscle. This blockage restricts blood flow and oxygen delivery to the heart, leading to damage or death of the heart muscle. During a heart attack, the body's sympathetic nervous system is activated in response to the stress and reduced oxygen supply. This activation triggers the release of certain chemicals, such as catecholamines, which can cause various symptoms including profuse sweating. Profuse sweating, known as diaphoresis, occurs due to the body's attempt to regulate its temperature and cool itself down. The release of catecholamines stimulates the sweat glands, leading to excessive sweating. Diaphoresis is not specific to heart attacks and can also occur in response to other medical conditions, intense physical exertion, anxiety, or certain medications. Sometimes people who have had a heart attack describe having a sense of impending doom, anxiety, or a feeling that something is not right. While this may not be a typical symptom, it's important to trust your intuition and seek medical help if you strongly sense that something is wrong. Irregular heartbeat, also known as arrhythmia, can sometimes indicate an impending heart attack. However, it is essential to note that not all cases of irregular heartbeat are directly linked to a heart attack, and not all heart attacks are preceded by irregular heartbeat. It's always best to consult a medical professional for an accurate diagnosis and appropriate treatment. That being said, certain types of irregular heartbeat may be associated with an increased risk of heart attack. One example is ventricular fibrillation, a life-threatening arrhythmia characterized by rapid, erratic electrical activity in the heart's lower chambers, ventricles. Ventricular fibrillation can disrupt the heart's pumping action, leading to a sudden loss of blood flow to the body and potentially resulting in cardiac arrest or a heart attack. Another example is atrial fibrillation, a common type of arrhythmia where the heart's upper chambers, atria, beat quickly and irregularly. Atrial fibrillation itself may not directly cause a heart attack, but it can increase the risk of blood clots forming in the heart. If a blood clot travels to a coronary artery and blocks blood flow, it can result in a heart attack. Feeling weak or experiencing sudden weakness, especially in combination with other warning signs, can be an indication of an impending heart attack. Weakness occurs when the heart cannot pump enough blood to meet the body's needs. If you feel weak without any apparent reason, seek medical attention promptly. If you found this video valuable, please give it a thumbs up and share it with your loved ones. Remember to subscribe to our channel for more health-related content. Stay safe and take care of your heart.